Hi, I'm Dr. Nidhi Agrawal, consultant obstetrics and gynecology, practicing at Cloudnine, Patparganj, East Delhi, and Noida. Asthma is, I would say, one of the commonest chronic illnesses which we see with pregnant ladies, especially with the rising pollution in our metros like Delhi and Bangalore. We see a lot of patients having these respiratory issues and some degree of obstructive airways. And so asthmatic conditions are very prevalent in our pregnant women. What are the possible complications for mother? Mother can have an exacerbation, that's worsening of her asthmatic symptoms. Why would she have that? Because during pregnancy, there is an increase in oxygen requirement. So the mother tends to hyperventilate. And due to the influence of hormones, there's a little bit of edema. Then even the maternal immunity, there is a shift. Then sometimes mothers are getting worried that I should not be taking the asthma medications. And so they may become non-compliant with the medications. So all those things make the asthma worsen during pregnancy. Having said that, it's not that all the mothers would have a worsening. It's only 1/3 of the mothers who are going to have a worsening of asthma. 1/3 would have a similar course and 1/3 would surprisingly improve. And we haven't found any, scientific theories to this, but this is an observational study. So for the baby born for asthmatic mothers during pregnancy, because of the impaired oxygen supply to the placenta and the fetus, the babies can have a growth restriction, the babies can have prematurity, and then the complications associated with prematurity like respiratory distress, like NICU stay, and all those complications and infection, those are the risks. And sometimes they are at a higher risk of preclampsia. They're more at risk for operative vaginal deliveries or elective cesarean sections, because the mother's asthma is not controlled and she is unable to take the stress of labor and is unable to bear down. So somewhere we try to cut short the second stage of labor, or if the mother is just not ready to go into labor, so we have to do a cesarean section on maternal consent. Yes, asthma medications, most of them are really safe in pregnancy, and the commonly used drugs, I'll tell you, they are salbutamol inhalers, they are low-dose steroid inhalers. They are mostly prescribed by your physicians or pulmonologists, and they are entirely safe in pregnancy. You should not be non-compliant with them, because that is the problem which arises. And if you have a doubt, please come to us, please come to your physician, discuss. Do not do over-the-counter medication, do not stop the drugs on your own. In cases of moderate or severe asthma, your doctor may add a beta-2 agonist, which is a long-acting medicine, or they may, add some inhalational steroids. So those are also safe. In severe cases, intractable cases of asthma, you may be advised to take systemic steroids. So systemic steroids are definitely a category C drug in pregnancy, not routinely advised. But when it is advised for severe asthma, please do take it, because only a healthy mother can give birth to a healthy baby. So for a short period, it will not have a problem. To lower the chances of asthmatic attack in pregnancy, first thing is compliance to your regular medication. Follow up with your chest physician or pulmonologist. Third thing is, if you smoke or if there is a exposure to passive smoking, cut down on that. Fourth is, cut down the triggers. The triggers can be stress itself, the trigger can be dust, pollen, so try to avoid these triggers. And that is how you can bring down the risk of exacerbation.